Good evening, everyone. Good evening. You're all welcome this evening to another episode of Menopause Conversation. This evening we have menopause and relationship, and we are going to delve into that shortly. As we all know that many women across the UK and across the world suffer from symptoms of menopause, and even up till now, many of us do still not understand the symptoms, the treatment. Hence, we are running this program to educate and to impact knowledge. So this evening with me is, I'm going to co-host, I'm the host this evening. My name is Uche Ademewa. With me is Sister Jill Derry Williams, who is co-hosting. But our guest speaker and our main speaker who has been doing the training with us is Dr. Pearl Onyekuru. So Sister Jill, you're going to say hi to everyone by waving your hand.
Hello, everyone. Hi, welcome.
Yeah, hi, Staji. Thank you for being part of the program. And on Zoom as well, we've got some guests with us on Zoom, and then on YouTube, everyone is welcome. I'm just going to give Dr. Pearl a few minutes to just introduce herself one more time. But I know that Dr. Pearl is a clinical lead and she's a public speaker, especially from last 2 weeks time we had the program. We can all testify, and we have got comments from all of you. Thank you for commenting. And Dr. Pearl has a very special interest in women's health, especially menopause, diabetes, and hypertension. Dr. Pearl, can you say one or two words about yourself, and then we can proceed?
Hello, good evening, everybody. Thank you for having me on the program again. My name is Dr. Pearl Onyekuru. I'm a GP, and I've been a GP for the past 20 years and a doctor for even longer than that. I currently work in London, in Cheshunt, where I'm a GP partner there. And I have done several things over the course of my career. My main interest now is menopause care and women's care. Of course, I do cover diabetes, mental health, and hypertension, which are, sort of really the bedrock of general practice. And of course, it's not just looking at health conditions, it's also looking at illness prevention and what we can do. So for me, menopause care and women's health is very close to my heart, not just because this is a phase of life in which most of us are in or are facing soon, but also because of the impact it has on health and how we can sort of manage ourselves during this, this phase of our lives. So thank you so much. And thank you for joining.
Thank you very much, Dr. Pearl. Now, you know that this is Prayer Corner for Workers, where workers meet together to have a word of prayer every day before we start our activities. We're going to ask Sister Jill to say a short prayer for us as we delve into the program.
Father in heaven, we just want to thank you that we are here again 2 weeks after we have received our first session of menopausal discussions. And God, you know that we have gained a lot from it, and many of our friends and family are so thankful that this program has been set and have been executed by Dr. Pearl, and they have gained a lot. And Lord, we know tonight they will gain again because your spirit and your holiness is in this place and with us. So Lord, imbue Dr. Pearl, give her all the necessary elements that she needs to continue her work as a GP and as a clinical professional. And I pray, dear Father, that tonight we would all gain again newness in understanding of the woman. In Jesus' name I have prayed. Amen.
Amen. Amen. So over to you at this moment. The floor is yours.
Hello, good evening, everybody, and thank you once again for having me. So today, our topic is really going to be about menopause and relationships and the impact that menopause has on women and their relationships, particularly intimate relationships, but also relationships within both the working environment and with colleagues. So it's definitely a very important topic, and there are definitely a lot of things that, you know, we can discuss and that will impact women. So when it comes to relationships, you know, you can ask yourself, can menopause cause relationship breakdown, or how much of impact does menopause have on relationships and breakdown of relationships? And we know that there does seem to be a correlation between menopause and divorce rates, and that has been shown to be quite a significant majority of women who in the UK who get put forward for who file for divorce are usually within the 45 to 55-year-old bracket, which is typically the age of menopause and the perimenopause. And a number of women do cite menopause as the cause of their marriage breakdown. But there are also other aspects that menopause can have on a woman's ability to maintain a relationship, and the impact that the menopause has on her being, her understanding, how she feels in herself, her confidence levels, and her health, and her ability to stay in that place of multiple roles. So, you know, probably a wife, a colleague, a mother, a daughter, and a support network for her friends. So we want to talk today about how does menopause reduce intimacy in a relationship? And what's the effect of menopause on a woman's mental health? Some of the common symptoms of the menopause, and we have discussed this in our previous talk. So if you are quite unsure, you can definitely look back on the prayer corner for health workers, and you know we did quite a comprehensive talk then, but we will go over it again. We will talk about how can menopause affect relationships? How can menopause lead to divorce? And can it lead towards anger towards husbands? And are affairs more common during the menopause? But also, what can you do both as a woman to look after yourself during the menopause, and also as a partner to support your partner during the menopause? So, you know, this is a talk. I want this talk to be very interactive. You know, I'd like people to ask questions and to really reflect, you know, on whatever it is, on what they're feeling, what they're taking away from this message, and how it impacts them. So we do know that when it comes to menopause, and we're talking about reducing intimacy in relationship, one of the biggest concerns both men and women have when it comes to menopause is the loss of physical intimacy. And why is that important? So normally if you speak to men, most men see physical intimacy as a sign of not just connection, but also as a sign of affirming love and connection. For women, you know, that is also an expression of love, you know, of care, of relationship, you know, and of connection to a partner. But during the menopause, we do know that a lot of women will experience vaginal dryness, as well as increased infections that may make sexual activities a lot more painful. They may find that they have decreased libido, and libido can be defined as not just the desire for intimacy, but also the ability to receive pleasure and to give pleasure. And as a result, that can make intimacy quite unappealing. And when this happens in the context of a relationship, most women might find that because of either vaginal soreness, vaginal dryness, irritation, a lot of women find that they have recurrent urinary tract infections, either during or after sex, or they may find just, you know, intimacy and penetration very uncomfortable. And this can then lead to, and if they don't really understand, you know, what the causes are, you know, that might cause a withdrawal of that desire, or even just, you know, the need for intimacy because of the amount of discomfort that can cause. And that can be a real, you know, a lot of women can find that really difficult to manage. Their partners as well can find that they feel as if they are they may feel that they're no longer loved, they're no longer wanted in the same way. They may feel as if they're drifting apart, and then this can impact negatively on not just the quality of the relationship, the intimacy, the ability to communicate, and that drifting apart can then begin to be the initial catalyst for relationship breakdown. We also find that women find that they may have problems with their mental health, and as I work as a general practitioner, and I speak to women all the time, and a lot of women don't often bring forward, they will not talk about how they feel of their mental health in the context of menopause, really, because a lot of women don't really put that connection. They don't understand, they are unaware that menopause can affect your mental health. And sometimes it's not really depression or anxiety. It may be that they feel that they can't find themselves. They feel lost. They don't feel themselves anymore. They may feel a lot more anxious. They may find themselves very tearful. Sometimes they find that they can be quite irritable. Little things set them off. I have women tell me that they're snapping at their partners, their children, as soon as they see mummy coming in, they're diving out of the door, out of the next room, because, they're not sure what mood mum's going to be in. And this can have quite a detrimental effect on not just the relationship with the partner, but also within the home as a whole. Sometimes women, they can appreciate the fact that they don't feel themselves. And a lot of women don't understand, the changes that they find within their personality. Some women can find really frightening, and they think, a lot of women might think, well, is this, am I getting dementia? Am I losing my mind? Am I depressed? But I don't feel depressed. And so, being able to understand that this can happen in the context of not just the menopause, because, you would describe the menopause as a year after having had a period, or a year after your last period is menopause, but in the perimenopausal period, which is the time or leading up to the menopause. And if we can appreciate that the perimenopause can last anything 7 to 10 years before a woman becomes menopausal. So if the average age for menopause in the UK is typically about 50-51, and it may change for different groups of women. So for some women, especially if you're Afro-Caribbean, you might find that your menopause may start earlier. And so 10 years before that, maybe in their early 40s. And so a lot of women may find that their moods are changing. They can't manage, they find it difficult to cope. Typically women have always been, had broad shoulders. They have, a lot of emotional resilience. They can manage, juggle a lot of things within the home, within the work, within the context of family. And they might find that during this period, they find themselves really struggling, or they find that they're no longer able to cope as effectively as they would. And this can have quite a detrimental effect, both on how the woman feels and sees herself, but as well as how she relates to others. And this can then affect relationships. We also want to talk about how this can affect a woman's confidence in herself, her abilities, how she sees herself, and how then she's able to manage how she goes forward. So what are the common symptoms of menopause? So like I talked about the perimenopause, which is the time leading up to the menopause, a lot of things can be quite dynamic. We find that women might find that not only are they having mood swings, they may find that their moods are up and down. They find that they are no longer, as resilient as they were. They may have trouble sleeping. And if you're not sleeping very well, as we know, that can really affect, how you function the following day, whether you're snappy, whether you get on with your colleagues at work, whether you get on with your family at home, whether how you relate to your significant other. And these can really, really be, have a huge impact on that relationship. Other things that may happen would be things like reduced communication, especially if a woman is quite unsure as to what's happening to her. She may not understand, she may be unaware that, these changes could be perimenopausal. And she might find that really difficult to navigate what's happening. Some common other menopausal symptoms may be, like I said, decreased libido, mood changes. She might find that during this period she's gaining weight. And if in this our current world where everybody's on is on TikTok or online, and if you've always looked a particular way, and women find that they are they're putting on weight and they haven't really done anything differently within their lifestyles, they might find that weight gain makes them feel it can make them feel quite depressed. It can make a lot of women feel very unsure, feel that loss of confidence because their bodies are changing. We do know that during the perimenopause, a lot of women tend to gain a lot of weight around the midriff, sort of around the middle. And, and that is really because as the hormone levels are going up and down and, as they're decreasing generally, the body is trying to make more estrogen from somewhere else as the ovaries are beginning to fail or to become less productive. And so women find that they may, despite exercising, they may find that they are gaining a lot of central abdominal fat. So, no longer being that nice, curvy, slim, gorgeous woman that they were. And that can really have an impact on, on how they see themselves, whether they want to go out because they feel they're beginning to look frumpy. If the hair changes, and we know a lot of women have hair changes during the perimenopause and menopause, the skin begins to change. And that can also then affect how they view themselves and how, and that can then spill over into how they relate especially with their intimate partner. Sometimes night sweats, chills and hot flushes can also be a problem where, you're having very poor sleep, you're very irritable during the night, therefore you're exhausted during the day, and therefore you don't have that emotional reserve and resilience to deal with, all of the little expectations or all of the activities and interactions that a woman would have during the day. Also, during that period of decreased fertility, because we know fertility will decline as a woman becomes perimenopausal. And a lot of women, if they either have not completed their families or they are unaware of the fact that this is changing, may find that very difficult to deal with. So a lot of this can, in the context of a relationship, this can make relationships very strained, especially because, a relationship takes two people at a minimum of two people within that relationship. And so if the woman really doesn't understand, her personality is changing, she's not sleeping so well, her partner may be unaware of what to do, how to help, what's going on. She may become very, very snappy, and that can be quite difficult, especially if there are other life events that are happening within that family context or within that home. A lot of women feel that they become very quick to be angry, they're very short-tempered, they're very irritable, and they find that they have more disputes. Some people, I've had women who would tell me they can't stand the sound of their husband breathing, they can't manage because for whatever reason they just feel irritated, and that can be that can be a real bugbear. If you're irritated from little things, some people find that just that sort of casual loving touch becomes it can be irritating, and that is in the context of the perimenopause and menopause. And it's not really that the woman doesn't want the intimacy. The changes as a result of the hormonal changes can make her feel less receptive to that. And so why do these things have an impact on women? So a lot of these things could be, that failure to communicate, a change of feelings towards each other. And if a man, or her partner, her significant partner is really struggling to understand and appreciate, he may begin to feel unloved. He might not be able to know how to respond. And therefore, either he becomes, he might be, I wouldn't say aggressive, but, he may withdraw. He may not want to interact. And then, that a rift sets in and communication breaks down. And then, couples, sort of drift apart. We do know that for some women, in order to manage how they feel, some women do become addicted to alcohol because it makes them sleep. And so, they may be drinking surreptitiously, or they may be drinking overtly, really because they're looking for a way to manage how they're feeling. They might want to manage their moods because they're not sleeping at night. And so that can really impact, that can in its own way put a strain on that relationship. Sometimes if women are really struggling at work, they may find that a lot of women, when in that sort of perimenopausal period where they are also struggling with things like brain fog, their brains don't feel as sharp as they used to be. They feel they can't, they can no longer, they're no longer as confident in their job. I have women who say, look, doctor, I can't remember what I'm supposed to be doing. I'm looking over these paperwork and, I'm seeing the words, I can't understand them. I can't read them. And, and that is in the context of, hormonal changes within the brain. And so a lot of women during that period may begin to think, well, if I can't do my job, I don't have the confidence to do the job as well as I've always done it, then I might need to either reduce my hours or, go part-time, or even, leave the job environment, or look for something that is less challenging or less professional. And of course, that may bring financial strain on the family. And, of course, we do know that finances can be a number one cause of marital stress if money is not handled well in the context of a marriage or a relationship. Also, the loss of intimacy, and affection can really be impact. The lack of sexual intercourse, because the woman just doesn't feel that she wants, because of all of these other symptoms, the dryness, the soreness, the irritation. Some women can feel so bad that they feel so dry and so sore and irritated down below that they can't bear to be touched. And we know that all of these things can then impact a relationship. And of course, we also find that, in the context of women with a lot of anxiety symptoms, we also know that some women find that they ache all over. They have a lot of generalized body pain. And and so in that context of that, they don't want to be held, they don't want to be touched, they're no longer as active, or they don't feel they can be as active as they have always been. If their joints are hurting, all of the activities that they probably had done in, previously quite happily, they find that they're struggling to do them, So whether it's going to the gym, going out for a walk, whatever hobbies that they had before, they may find that they're stepping back from all of those because of these, the changes in their joints, because of joint pain and body pain. And so that, that can then cause a rift in the marriage, especially if these were what were previously common and shared interests. And of course, then with the lack of intimacy, with the emotional changes, the behavioral changes, the lack of confidence, the body changes. I'm sure we can begin to see now how changes in menopause and perimenopause can definitely begin to impact marriages and relationships. And so we really know that some of these things can be quite impactful on, and they can really cause a lot of breakdown and struggle within marriages. And the other thing is, a lot of partners, because a lot of women may not understand, they don't know how to communicate well, they may not be able to talk to their partners properly, or they won't understand what's going on, they don't know where to seek help. And a lot of women may be offered, they speak to their GPs and they're offered antidepressants. And, what we call NICE is our clinical excellence. It's a National Institute of Clinical Excellence, which is, it's like the guidance for medical practitioners in the UK. And the guidance from NICE is that women should not be offered antidepressants in the context of mood changes in the menopause and the perimenopause, because they're not really effective, and in some ways can make women feel even worse. They can blunt affect, they can make women feel really down, make women lose that ability to have pleasure, and so that can then really make her symptoms worse. Some women can become so withdrawn or so badly affected by the perimenopause and menopausal changes that some of them become actually suicidal. They have very severe depression and anxiety that they can't, they struggle to leave the house or struggle to even, interact not just with their partner, but also with children and with other members of the family, with work. And so that can be a real struggle, that can have a real negative impact on relationships. So one would ask, what can you do, if these, if you can find yourself, or if any of these resonate with you, what are the options that are available for a woman who is going through any of these, or who has any of these symptoms or is struggling in her relationship. And so I would also start, go back to the very basics. So first and foremost is to be able to understand and to recognize what's happening. Sit back and ask yourself, where am I in my age? Where am I in my life? What's happening to my periods? Are they changing? And we don't have to wait to become menopausal for any of these symptoms to occur. You might find that your periods are either coming a bit shorter, they're a bit lighter, they may be a bit longer, they may be more spaced out, they may become closer together. But if there are changes that are happening, then that may be indicators that things, your hormones are changing. And think about your hormones in the context of your relationship. You might find that you're beginning to have hot flushes, and some women may have, the typical hot flush where you have this internal heat that sort of comes from the center and just goes up, and some women just feel hot. Some women don't have any hot flushes and just have night sweats, and some will have, may have them once a month, or they may have every night. Some women can have several every night, and they can't sleep. So the essence is to be aware of what the changes are. A lot of women find that the anxiety can be the real the pointer. It may be that their skin becomes itchy, their hair is drying out. A lot of women have a lot of joint pains. And for some women, it might just be the vaginal symptoms. They have a lot of urinary tract infections. They're getting very sore down below. So the essence is to, track your symptoms. There are very good apps that you can use to look at your symptoms and track your periods if you're going through that perimenopausal and menopausal phase, and just be aware. So I always think that women's empowerment and understanding is key. Another thing then is, if you believe that this is happening to you, have the courage to go and speak to your healthcare professional. And I always think, find somebody who is going to listen to you. You may have just one, if you speak to one practitioner and you don't feel that you've really been listened to, go and speak, ask to speak to somebody else. Don't always be put off by the first practitioner that you speak to. Another thing is, then making sure that you're getting the right advice, in the context of, what is right for you. And for the majority of women, we know that hormone replacement therapy is safe for majority of women. So that's definitely an option. But what are the other health things that you can do to help yourself, in these times? So other things would be, having the ability to express to your partner what's happening. So, be able to find a way to, have those open discussions, talk to your partner about the changes, about the hot flushes, about, any night sweats that you might be having, about any mood symptoms, because your partner may be able to, help you sort of analyze and appreciate what these changes are. You can also think about exercise. We know that exercise, if you exercise in the context of the perimenopause and the menopause, or for health in general, that we do know that it improves your mental well-being, it improves muscle strength, it will help you sleep better, and it helps digestion, and it will help weight loss and weight management. So always look at exercising as much as you can. And it doesn't have to be going to the gym. I tell women, you don't have to go to the gym, go out for walks. You might exercise in your home. There are 1,000,001 YouTube things or apps that you can, download and, find something that suits you that you can do and try and be consistent with it. Another thing is looking at your diet, because we know that diet is key during for every person at that stage. But as we go into the menopause and through into the perimenopausal transition phase, you want to make sure that you're eating as healthily as you can. We also want to look at the kind of foods that you can eat, and we talked about it in our last program. But you really want to think of, a Mediterranean diet is pretty much, this in some ways a gold standard diet. But I think any diet that is, I think of it as a rainbow diet. So you're eating a lot of, brightly coloured vegetables. So whether it's your cabbage, your kale, broccoli, red peppers, sweet peppers, you have your microbiotic nutrients, you have your probiotic nutrients, they are all good. You're making sure you're having your adequate vitamin D intake, your calcium intake is preferable if you can get adequate vitamin D in your diet, as opposed to having a tablet. But if you need to have a tablet, then that's fine. But if you can have it through your diet, making sure that you have enough, things like tofu, soya, some of the fermented foods can really help. So, eating less carbohydrates, having a more protein-based diet, a more sort of vegetarian-based diet. But of course, meat, if you like me, I love meat. But, making sure that you're balancing that out. So those can be areas where you can really, help your not just your general health, but also it will help you sleep better. And if you sleep better, then that will help you through some of your menopausal symptoms. Then the other thing is, being open with your family about how you're feeling. We also talked. Then the other thing is getting help, if you're having a lot of vaginal dryness, a lot of vaginal soreness, definitely looking at, what sort of vaginal treatment that you can have. Now, if you have what it's called genitourinary syndrome of the menopause, which is vaginal dryness, or in those days we used to call it vaginal atrophy. That means your vaginal bits are withering away due to the menopause. Typically, the only really effective treatment for that is vaginal estrogen. But of course, moisturizers can help, lubricants can help during intimacy. And so being able to help yourself to use some of those vaginal estrogens and some of those vaginal lubricants can really help a lot of that vaginal soreness, take away a lot of the irritation, and then of course that can then help improve intimacy and the desire for intimacy. So those are some of the things that we can really talk about. And the other things really is also looking at things like mindfulness, making sure that you're looking after your emotional health, looking after your spiritual health, finding ways to connect with, those who are, those who are important to you. So whether it's taking yourself out for a coffee, spending time with your loved one, finding ways to bridge those, some of, to to bridge those gaps, and making sure that you feel connected to those who are important to you. So those are some of the ways that you can actually find, get help. And so as a partner, what could you do as a partner to support, your wife or your girlfriend who is, going through the menopause and who is struggling with intimacy and relationship? Because this is it can be a real challenging time for women, as, their bodies are changing, their hormones are changing, they're losing that reproductive ability. And for a lot of women, most women, their currency as a woman is her ability to have children. And when you go to that point where you're no longer able to have children, or you're going through that phase, that can be, a lot of women can find that a real challenge, emotionally to deal with. And so as a partner, how can you support your wife or your girlfriend or your female partner who is going through the menopause? So the essence really would be to say simple things like do your research, have a look, just be open and be mindful. So do your research, ask questions, in a kind and a caring way, so that, that woman feels supported. Sometimes, for a lot of men, it may be that the partner that becomes aware that this could be menopause, or these could be perimenopausal changes, or he's the one who would notice that, your cycles are changing, your periods are coming, instead of coming once a month, they're coming twice a month, or you don't seem to have had a period in the past 3 months, so as a partner, just be open and be mindful, and try and support your partner. So try and do your research to understand what might be happening. Another thing is be patient. We do know that the perimenopause and the menopause changes can last a long time, but in the perimenopausal phase, we do know that things can, it is a period of flux. So, things may have symptoms that might settle down for a while and they flare up again, or and there may be some symptoms may improve and some new ones will come through. So, if you can be patient with your partner, and then just really to support her during what is a huge emotional change for your partner. Another thing is to talk. Spend time, talk in a way that allows consideration, that allows open dialogue, that is non-confrontational, that is supportive as much as you can be. And you might not be able to offer all the answers, but you may be able to signpost and say, well, if you're feeling like this, why don't you speak to your doctor or speak to your GP? Have you spoken to your friends about this? See where you can go to get some support, both for yourself and for your partner, and be able to try and keep those communication channels open. We'd always talk about working as a team, because just as a woman is changing, for most women, they are most women are the pivots of their homes. So if the woman's good, then the home is good. If the woman's not good, the home is not good. So try and be that teammate for your partner, so that you try and support her during those difficult periods, and like I said, you may not have all of the answers, but the essence really would be to just try and support her, just try and signpost and try and be understanding and open. And it may be just nudging her towards some resources that she might find helpful. You can then appreciate her confusion, and most men may struggle to understand what's going on. But a lot of women themselves are also struggling. So if you just are there as a good listening ear, you will appreciate what she's going through and be there, be that pillar to lean on, that partner, that loving partner, then that can really help through can be a really difficult time for a lot of women. And we can always also talk about making sure that, you can get, I would say always for all women, consider having that discussion about hormone replacement, because, I believe that there are a lot more benefits for hormone replacement than there are risks for the majority of women. But of course, there will be some women for whom hormone replacement is not appropriate. However, lifestyle changes and lifestyle support will always be the foundation of making sure that women go into the post-reproductive phase of their life in the best way possible. It might be, if you're a partner, you can support your partner by going out, encouraging her to not just do the things you want to do, but do the things that both of you can do together. And that can be a real anchor for what can be a difficult time. Some women will find that they need to have a change in sexuality, or how they express sexuality and intimacy, and being able to embrace that and be open to that can be really beneficial. And then, not feeling as a partner that, you're not loved or you're no longer appreciated. So being able to support your partner in the bedroom, but also out of the bedroom can be really good to help, that relationship. And of course, all women want reassurance. Everyone wants to feel that they're loved and they're, and they're appreciated. And so being able to share, to reassure that woman, your partner, your female partner, that, she's very much loved, she's very much appreciated in whatever love language that is her love language. And sometimes it's understanding that, knowing what it is that is her love language, and being able to show appreciation and show love in her love language. So, sometimes we don't always know what our love language is, but, if you take time to learn it, or talk to your partner about what her love language is. How does she want to be appreciated? How does she want to be looked after? How does she want to feel loved? So whether, and every woman has what is important to them. Some women want to be talked to. Some people want to just spend time. Some women want a lot of physical touch. Some women want to be appreciated with little gifts. So find out what your partner's love language is. And and try and express your appreciation, your love for your partner that way. And of course, the essence is, always be a team, because ultimately, even if you have children, the children will grow and they will leave the home, and then it's you and your partner that are going to be left. So yet what you want to do is to go into that phase, I wouldn't call it the twilight phase, but the third phase of your life as strong as you can, as partners, as husband and wife or spouse or whatever nature of relationship you have, being mutually supportive to each other. So that's I hope that you found that helpful, and if you have any questions or have any support suggestions, then please feel free to bring them forward. So I hope that's been helpful.
Yes. Thank you, Dr. Pearl. It wasn't a hope, it was, I don't know the word for it, it was just helpful to all of us, especially to me. I sat here and I kept going back into my mind when I had my children and they were growing up. And excuse me, sometimes I used to be very irritable and I didn't know why. And today I was just reflecting on my life and I kept thinking, well, Gillian, probably was going through your perimenopause state and your menopausal state, and so you were having all these mood changes and so on. After our discussion last week, my neighbor, who is quite young, she's about probably 42, and just by chance she came to my door. We were chatting, and she said, "Gillian, I'm going through menopause, And I said, 42. I said, oh, wow. We were just discussing this last night. And I need to give you the link so you can listen to Dr. Pearl and to what she has to say about early menopause. But the question arose. What she told me is that all of her women in her family, they go through this early menopausal state. And I want to ask, is early menopausal hereditary, or is it just relating to individuals?
So what the studies have shown really, and it does be, you know, the thing is, there hasn't been so much by way of research around some of these topics, but what we, you know, what's the little research that we do have, we do know that most women in a lot of ways may mimic their mum. So if your mother had an early menopause, then there is always a possibility that that will happen down the line. And, you know, some of these things are genetic. They may not be hereditary, you know, per se, but they are in the genes. But having said that, in the context of an early menopause, there were studies that have been shown that if you have so you have what you call an early menopause and premature ovarian failure. So if you have a menopause below the age of 40, then we call it premature ovarian insufficiency or failure. That means that your ovaries have stopped working too early. If you have an early menopause, that's before the age of 45, then that is early menopause. And what all of the studies have shown is that the longer women have their hormones, the healthier they will be into older age. And so the current guidance really is that women should have hormone replacement at least up until the age of 50, 51, or the natural age of menopause for the majority of women, because the longer a woman lives without her hormones, the more likely she is. There are health risks associated with low hormones at an early age. And that is really now being a lot more recognized, the impact of, you know, that hormonal deficiency state in women. And so, you know, I would definitely, encourage your friend or anybody listening who thinks, you know, we're going to soldier through as we all thought we would do, you know, we're going to, you know, get on with it. You know, hormones are bioactive, you know, chemicals that our body makes, and our bodies are designed to live with, you know, with our hormones. And we know that as women go through the menopause, especially if you have an early menopause, then it is a phase of our life that, you know, so menopause is an area of life or a hormone deficiency with health risks. So it's not without health risks. And we've talked about them before, you know, the risk of heart attack, the risk of Alzheimer's, the risk of osteoporosis. You know, there are other studies to show the risk of, you know, depressive, you know, anxiety and depression, mental health, concerns become a lot more. A lot of joint and muscle pains worsen over those periods. So it is, you know, it is definitely a time where women really do need to be thinking about, you know, about their hormones and making sure that they at least, you know, have replacement up until at least the age of 50. But of course, you know, there's no age that is too young, you know, if you're menopausal, and there's no upper limit in the current NICE guidance so if you know, so women can be on it, you know, for as long as the benefits outweigh the risk.
Thank you, Doctor. Thank you very much.
Okay, thank you very much. Thank you for the question, and thank you for the answer, Doctor. The next question that I've got here is, can using contraceptive, especially the coil, start someone on early menopause?
So the coil, there are two types of coil. There is a hormone-bearing coil and a non-hormone-bearing coil. So I assume the question is about the hormone-bearing coil. So what it does is it doesn't start you on an early menopause, even though it may mean that you don't have periods, because it thins out the lining of the uterus. But your natural, because it acts locally within the womb, so it doesn't have a systemic effect. It doesn't affect the hormones of the whole body. It only acts locally within the womb, and so it is quite a safe form of contraception for women. And if women have it in the context of very heavy bleeding, it can be a really effective way of managing heavy bleeding. It can also be used as the progesterone component of HRT. And so it will do, in that context, it will do a dual job. It reduces, you know, so it acts as contraception, but it also acts as, as the progesterone component of your HRT. And so it can be very useful. But in the context of give you an early menopause. No, it will not. It hasn't been known to do that at all.
Thank you. Dr. Pearl, I've got this question. Does menopause cause all sexual problems during the time of menopause? And
So,
if it does, is there any way we can differentiate which is what symptoms are menopausal or not?
So we know that sexual and sexuality for men and women is multifactorial. So there are many things that can impact it. Menopause is a significant factor, but it may not be the only thing. So we do know that if women are stressed, if they're going through a hard time, in the context of bereavement or job loss, or in the context of ill health, or even if the relationship itself is traumatic or is not a loving relationship, then yes, of course, the sexuality can be negatively impacted, because the majority of women, your desire for sex and libido rarely is, as much as we think of it from the heart, it actually comes from your head. So because that's where the neural pathways that initiate sex, libido, love, they're all in there. They're all from little organs in the brain. And so if you're stressed, some of those, or if there are other things going on in your life, or in the context of illness or ill health or whatever, then those centers are downregulated. That's almost as if the switch is turned down. And so that can impact on your ability to, that desire for sex and sexuality. But that's the whole essence of, doing a symptom questionnaire, so that you can look at, what is going on in the context of your life. And then, of course, see what would, where you're at. So there is a menopause. So if anybody is here, if you just Google menopause symptom questionnaire, if you put that into Google, you can always, download it. There are lots of free, free versions. And then, there's one from the, British Menopause Society, from the Menopause Charity. And then you can look at it in the context of all of the symptoms that are happening. And of course, then use that to help yourself. Either if you're still very confused, you can speak to your doctor. If not, you can just, have a discussion with a colleague, with a friend, because what you might think is just for you, is just happening to you. You might find that your friends are also struggling with some of those things as well. And look at where you are in the phase of your life, in the context of your cycle. Are things changing? Is your body changing? And so those are definitely the things I would say. Have a look.
Thank you. Thank you.
This is quite very educative. Thank you very much. Thank you, Sajid, for that question. And the next question we've got, I think, Doctor, you've touched a bit on this as well, is someone asking, please, Doc, is not seeing your period for at least 4 months a sign of menopause? Again, is it a normal sign? If yes, do I need to consult the GP? So that's the question. Probably touch on it, but it's just someone trying to understand that if they haven't seen their period for up to 4 months, does it mean that regardless of their age that they have gone into a menopausal time of their life? Yeah.
So thank you for that. I think that's a really important question. And what we would suggest is, in the context, so a woman's a woman's body has has different phases. So from pre-puberty, puberty, into your teenage years, your adolescent years, your adult years, into the perimenopause and the menopause. So there are phases for a woman's life. So you need to think about, where are you on that phase? Now, if you're quite young and you haven't seen your period for 4 months, then we do know, like I said, just in terms of, we talked about sexuality, a lot of the switches or these triggers for the hormonal cycle are actually in the brain. So this can be impacted by other things, from things like ill health, stress, worry, so there, and then of course there can be certain medical conditions that can impact that. So if you haven't seen a period for 4 months, and of course pregnancy. So if you haven't seen a period for, for 4 months, and you are not in the perimenopausal phase, then definitely you need to be speaking to your doctor about it, to say, let me have that checked. It may be, and then look at your life and think, is there anything that's happening in my life? Are there any life events that may have impacted me? But of course, get it checked would be my advice. If you're definitely perimenopausal, or you're in that sort of your early late 40s, and you haven't had a period for 4 months, then you can, and nothing else is impacting you. But of course, you need to make sure that your thyroid is working well. You're not anemic. There aren't any other health issues going on. Then definitely, I would encourage you to think about it in the context of your menopause and your perimenopause, but have that discussion with your clinician, and just make sure that you have yourself properly tested, and of course look at it in terms of the cycle overall. Because if you've just had, whether you've noticed that your periods might be getting a bit lighter, they get a bit heavier. So the cycle is changing. It's not just it's stopping. It may be changing, and so the essence really is to have a look at it in context of everything else that's going on, and then that will help you. And if you're really you're quite unsure, then speak to your healthcare professional, and they can guide you.
Okay. You spoke, Dr. Pearl, about education of your partner in terms of the processes of menopause. Is it right for the partner to attend clinical sessions with their partner to understand menopause?
I think all partners should be involved. I think every partner should be involved, because ultimately, one thing I do find as a clinician is that we can speak to women and discuss what's going on, and they go home and they're like, I can't remember half of what I was told. I can't remember what the doctor said to me. And there's so much to unpack in menopause and perimenopause. Another thing also is that sometimes women, especially when they're going to the perimenopause, because we're talking about this in the context of menopause and the perimenopause, they do find that they, I won't say that they lack insight, but they struggle to appreciate how they are becoming. And so sometimes having that outside person who lives with them all of the time can actually give them a little bit of context and understanding to be able to reflect better how they're, what they're feeling, or how they're feeling impacts on their behavior and their attitude. So and of course, it's also educational for the man as well, to be able to be there to support, to understand, to be able to help himself so that he can understand, because what's going on, and how he can support his wife during these changes. So by all means, I think all men should be involved in that conversation. And of course, men are, they're either husbands, they are brothers, they are dads, they are uncles, they are colleagues, they are bosses, they are in the workplace. So I think they're everywhere. Men, yes, just as you have women everywhere, you have men everywhere. So by all means, I think they should always be, they should always be involved in the conversation.
Yeah, I think it's a plus for all of the individuals involved to have that unique togetherness in terms of attending sessions and so on. And as you said, yes, it indicates that it gives the man some more understanding of how to deal with his wife and the changes that goes along with her. Sorry, my voice is getting terrible. Okay, sorry. So, Sister Uche, you have any other questions?
Yeah, I have one more question, and then we'll come to the end, because we haven't even got time now. Our time is off. But just before we just finish, Doctor, you probably have touched on this, and someone is asking, is reduced period days a sign of menopause, where someone's period has reduced from maybe 8 to 4 days, from 7 days to 2 days, or from 5 days to whatever days? Is that a sign of menopause? Someone is asking. And then on that, we would But once you answer that, then we'll just summarize and close the session for today. But it's been an amazing session, and I have actually been very blessed, and I have gained quite a lot of knowledge, really, and lots of response as well coming through. So thank you very much for this evening. Yeah.
Thank you so much. So, like I said, one thing with the perimenopause is that the perimenopause indicates the time of change. And so it doesn't, menopause is when periods stop. The perimenopause is that time of change. And so the change, and sometimes changes can be subtle, so it may be that if you had a nice regular 28 or 27 or 30-day cycle, that cycle may get a bit longer. So you might have your periods, they'll be in a 35-day cycle, they're coming every 42 days. They may be shorter. The periods themselves may be longer. They may be shorter. So if you're noticing any changes in your menstrual cycle in the context of, other symptoms. So for example, one is you look at how old you are. So whether you're in especially if you're your early 40s, your early 40s, middle 40s, or even if you're late 30s, then definitely that could be, there could be perimenopausal changes. You also want to look at it, in terms of making sure that there aren't any other things going on. So if you're getting very heavy periods, or other things can come up. So things like fibroids or polyps. So you have to look at it in its in its totality. But I would always say if they're still regular but are changing, then definitely, and if you're in that perimenopausal age, then if you do a symptom questionnaire, you'll be able to check and see, am I getting other symptoms? Because a lot of women are not fully aware of all of the symptoms that may be that are usually associated with menopause and the perimenopause. So whether it's anxiety, mood symptoms, hot sweats and night flushes, joint ache, muscle pains, vaginal symptoms, soreness, dryness, dry eyes, dry skin, palpitations, chest pains, all of these things, can be signs, can begin to come up in that perimenopausal period. So I would say, look at it in context, but definitely it could be, yes.
Fantastic. Thank you, Dr. Pearl. You have covered so much for us tonight. You have covered menopause under the broad umbrella and all the physical symptoms, the emotional symptoms. You have covered sex, and you have covered relationships problems and how we can educate our partners to our emotional and physical changes during the menopausal states. So we have come away with a wealth of information and how to deal with these and how to spot these symptoms and know exactly why we are going through these different changes in our bodies. And again, we have looked at menopause being hereditary. And of course, we have gained some more information on that. So thank you very, very, very much. Is there one more question, hint? Is there a particular site or link where we can get this information, especially for educating our partners on menopause?
So, I mean, there's a very good website, and it's called the Balanced Menopause app. It's a site. I mean, I didn't make it. I have no, financial interest at all. But it's a website that's been designed by GPs and menopause specialists, and so it's very woman oriented. It's very female oriented. So you can download the app. It is a free app. I always ask all of my patients to download it. It has a wealth of information. You can do your symptom questionnaire there, or your health, your health check on it, and you can look at all of the symptoms that you may not know will be happening, and you can track your symptom changes over time, and that will give you a broad idea of where you are with your menopause and your perimenopause, and then and it's evidence-based information. So you're sure that you're getting evidence-based information that is up to date, that is very current, but that is also very pro-women.
Thank you. Thank you so much. Sister Uche, over to you.
Thank you very much. Thank you, Doctor. Thank you, Sister Jill. We have come to the end of our program tonight, and I want to thank all of you for your comments. To those on YouTube, we know you are there, and once again, thank you for joining us. And to those on Zoom, it's been amazing to see all of you. We just want to remind you to remember to share the videos tonight. Share them, to the sisters, to the brothers. Share them because there's a whole lot of information we've been given, and Dr. Pearl hasn't charged us anything at all. So she's giving all of this free. So let's just share it so that everyone would benefit from the information. We just want to remind you as well that we have a lot of programs coming forth. If you haven't subscribed to the channel, this is an opportunity for you to subscribe to the channel. And we meet every morning at 5:30 a.m. to start our day with prayer. And this is Prayer Corner for Workers. We just meet as professionals to pray and to draw strength from each other. For the next program, we're going to be letting you know when the next program will be. But if you do want to join our WhatsApp group, you can also DM me your number and we can add you on the WhatsApp group. But just once again, just to say thank you for joining, and Dr. Pearl, thank you for the program. Everyone, you are all welcome and thank you. So at this point, we're going to say bye and good night, and see you tomorrow, 5:30 a.m. if you want to join us for prayer. Have a nice evening, everyone, and good night. Bye.
Bye.
Good night, everybody. Thank you so much, and thank you for being here. And to my friends who joined, I hope you had a nice time. Thank you so much for coming on.
Thank you, Dr. Pearl. It was very informative. Thank you very much. I hope the next time my voice will be okay.
Dr. Pearl, there is just one question. Someone is saying, thank you, but what is the name of the app? What is the name of the app before people drop off?
Yeah, so I'm just going to post it now. So it's there. It's called www.balancemenopause.com. So if you go to the site, then you can go to, it will lead you, you can then use it and download the app. So it's called the Balance Menopause app.
Okay.
So I'll put it in the, and that's my little niece. Thank you to